Local productions seen on Delta College Public Media are made possible with support from viewers like you. Thank you.
Hello, everyone. Welcome to Junia Doan's The Spark. I'm Junia Doan. Thank you for joining us. Today, my guest is Dr. Gianh Nguyen Portnoy of Doctors Portnoy Tu Family Dentistry in Okemos, Michigan. Welcome, Dr. Portnoy. Tell us how dentistry is practiced around the world, because I understand there are big differences.
Yes, in the U.S., we focus more on preventative dentistry. So, patient would come in every 6 months for their usual cleaning and checkup, and to make sure that we can catch anything early on with decay, so then we can fix it so it end up not being so expensive when you end up getting root canals or extractions or crowns and bridge. But in other country like in Vietnam where I grew up or I was born there, they don't have preventive dentistry. They're more like they only go see the dentist when they're in extreme pain. And in most cases, they end up the tooth is going to be non-restorable, so they end up like extracting the teeth. So they end up um, not able to save the teeth at all. So
What we were talking about extractions and making crowns in the office. You have one of those machines, do you?
yes, I have a CEREC machine that we digitally scan the mouth, and then I design the crowns, and then we mill it in the office, so then you can get the crown in the same day that you come in. Because normally when you do crowns, most office would just prep the tooth and then take impression, and then we send it to the lab. So there's some variable where we can't control like the setting of the impressions. And so when you come back, you end up having to adjust a little bit more, take more time to adjust the crown to have it fit better. But in our office, we love technology, so we had introduced our practice about 4 years ago with the technology of making the crown in one day.
What other new things in technology do you have or are you thinking of?
So our office also have a 3D images, so we can it allow us to take a picture and in 3Ds, and then we can diagnose the teeth much better, and also like tissues, not tissue, but so in our case, we can with the 2D image, you can't really sometimes can't see a crack in the tooth, but
Uh,
but with the 3D, you can actually see if there's a crack inside the tooth. And then we also have, I mean, we introduce a lot to our practice with the sleep apnea, and we do
oh,
3D, we do the mouth guards too. So
what when you go to school at an American dental school, what are they having you study? What is it is necessary to know, understand?
so dentistry, I've been out of dentistry for about 22 years. So um, I think nowadays the dental school offer the CEREX machine, which is the 1 day dentist. They have more technology than when I went to dental school. But usually you go to dental school to learn the basic, but most of it is when you get out is based on experience and what you learn and taking classes and
Hmm.
taking further education courses. So like I went into like after I graduated a couple years, I wanted to advance my skills. So I start taking at a Pankey Institute, which is a higher education, and it deal with more comprehensive overall dentistry, working with not just your mouth, but overall with a balanced life. So it introduced a balanced life, not just dentistry, but also personally and professionally.
You mean dentistry is now covering that as a course subject? Interesting. I just
Um,
wouldn't have expected that.
Dentistry cover, I mean, they don't do that in dental school. It's more learning the technical aspect of dentistry, but it doesn't teach you. I mean, it does a little bit of teaching you how to manage your dental office as a business too. But I think most of
Yes,
it is
probably.
learning from experience once you get out of dentistry.
What do you have to be or have to be successful? Is the size and dexterity of your fingers important? Like they can't be too big or too long, or hand manipulation and hand use? What's an advantage to have? Smaller hands, narrower hands, longer fingers, shorter fingers, or immaterial?
Um, I think it's you can't just focus on just one thing. I think it's just more with me. It's the passion of doing dentistry. Um, so I was like, if there's a way you can do it. So if you have big hands, you can figure out how to use it. But I'm lucky because I have my hands small. So a lot of patients would say, "Oh, thank goodness you have like small hands, so you can get into my small mouth." But I think it's more like the passion of doing what you love to do um, that makes it make you as a
Work.
successful dentist. Because most, like a lot of my instructor in dentist school said that, patients don't judge you by how pretty your crown is how you didn't hurt them during the procedure. So that's important too.
Yes,
But I also believe that my staff makes a uh, they're really important to the success of my practice because without great staff, I cannot do
yes,
my.
yes. If you're a wise woman. Do you find that I love your talk to me more about passion for life or passion for dentistry? Is your father like that about medicine?
Yes, he did. So he was a physician in Vietnam. So when we escaped Vietnam, so I escaped with my mom and my two brothers first, and then my dad came like 3 years later, and so he said that what he wants to do was to be a physician. So he decided to start taking tests and then did his residency. And this is like when he went to an interview for a residency program, the person was asking him, why did you want to continue? Or like 48 years old. And he said, because this is what I want to do. I can't see myself doing anything else. So he went through the residency program at 50. And so, I mean, it's the passion. So, I mean, if you don't enjoy what you do, then it's not worth it. And that goes with me too. Like, if I don't enjoy dentistry, I don't think I would want to do that. It would be a really boring life for me. So I'm kind of glad that because originally I was going to go into medicine like my dad. I wanted to be a pediatrician. But then my senior year, I decided that I don't know if I want a career, but I also want to raise a family too. So I decided to switch, took a year off and decided what I really want to do. And I love art and I love working with people and I love health. So then my cousin said that I should try dentistry. And I mean, I'm so glad that I tried it. And I mean, I love it. I don't see myself doing anything else.
Is it hard? Because I always thought, I'm really asking, you had to know about brain function and how everything interrelates and so forth or is that yet another doctor of?
Well, I mean, you and in dentistry
What
you can
part of the
focus.
mouth or cranium do you have to study and master?
I mean, in in dental school, you're exposed to, like, when we did the anatomy class, we did the whole body first in one semester, and then after that is focus more on the head and neck. But I mean, in dentistry, it's a general dentistry. You can learn anything. I mean, but if you want to focus on certain things, like, you can take more classes, or take, and education. There's a lot of classes out there that you can further your get more exposed to understand the topic a little bit more.
Do you do orthodontics there?
Actually, I mean, my practice now just this year has started introducing what we call clear aligners, which is like it's orthodontist, but we don't do brackets or anything. We more like do clear retainers. So it's minimal, like, it's not extreme case. So with those cases, I usually send it out to the orthodontist. But now with the cases where an older adult comes in and they say, "Oh, I need to fix my front teeth because it's crowding in a little bit in the lower," and so I would do those. My practice is starting to do that now this year.
I see. Do you see anything coming along soon that will help ward off the deposit of plaque from our teeth, other than all the various things that have been so far developed?
I don't think, I mean, it's just mainly preventative, meaning coming in every 6 months to get your teeth cleaned. Because when you do it at home, you don't do, when you use the toothbrush, you don't get way down to the gum line like we do. So I think it's the preventative is more coming in to see the dentist. And I mean, there's the electric toothbrush that you can use, and just learning how to use it correctly also help too.
How did you get your study habits so intense that did you speak English or parents speak English in Vietnam?
No, actually, I came to the U.S. I escaped from the Vietnam when I was around 7 years old. So, I mean, I think I still have a little accent from it, but yeah. So I learned English in the U.S. actually. So my dad did it a little bit in school. So he writes really well, but speaking, it's a little harder. But like any language, it's probably the same thing. Reading and writing is really easy, but speaking, unless you like immerse yourself in the country and kind of do it all the time, then I get better at it.
Did he have to take a board certification tests all over again
Yeah,
in
he did.
America?
So my dad did. Yeah, so he has to recertify by taking all the Boyd's tests. I think back then they call it flex or something. And usually most foreign doctor take it, and they would take it many times to pass. But my dad, he's very studious, so he passed it in one try.
Oh my
So
goodness.
yeah, so
What
my
did
dad,
he teach you about studying?
so my dad, he loves reading. So, but he's very intelligent. He's really smart. So in Vietnam, you have a ranking throughout the whole country, like like um ranking in, like, how you place in tests and stuff. And so my dad was probably in the top 10 in the country. So I mean, he's very smart. I mean, yeah.
Did he require high grades from you, or you sort of felt impelled to do that?
I think I think it's both. I mean, he doesn't say like you have to get A's, but I think it's just I myself have high expectation for me. I tend to be like a perfectionist in some way. So I'm really hard on myself more than he's hard on me. So I mean, with in the US, I mean, a lot of time they said in order to be successful, you have to education is really important. So that's what he would say. Education is really important. But he also, like, believed that music is are important too, and sports. So, growing up, I played like the piano and the violin, and then I also played tennis. So it's over being an overall rounded growing up. It helps me with being successful in my life.
Did your brothers have the same attitude towards study?
Yes. So my oldest one is a doctor. So he's an ER doctor too. So he actually went back. So when he was in college, I think he wanted to be a doctor, but we couldn't afford that to go to school. So he wanted to do something that was quick, so when he get out of college, he can make money. And so he graduated with an engineering degree at University of Illinois. And then after that, he worked a little bit and then he went back to take the classes because he wanted to go to medical school. So now he's in medical school. And then same thing as my younger brother. He didn't want to be a doctor, but he wanted to be successful. But now he's actually a director of uh, uh, what's called pathology association. So it's somewhat indirectly, he's also gone into the medical field like my dad.
Interesting. All of you have a desire to help.
Yes, yes. I mean,
Interesting.
I love to help patient, and I mean, I used to be an introvert too, so I'm better with the one-on-one, being one-on-one with the patient. I think I feel more comfortable. So in certain situation, I tend to be an extrovert, but when it comes to like if I go to a party, I tend to be more of an introvert.
Sometimes introverts get overwhelmed if there's too much noise around them, too many people talking. And I was just asking, in a sense, of how much time can you be at a party or a gathering before the noise level just wears you down and you want to
I don't
leave?
think it's the noise level doesn't really bother me as much. It's being like social. I think that's aspect. Like my husband is totally opposite from me. He tends to like at the party. By the end of the party, he probably has spoken to like most of the people at the party. I'm the opposite. I tend to like hang out with one more person. Like one on one. So I tend to know that that person a little bit more by the end of
Yes.
the yes. Hmm.
Now, how did you bring up your children? Was there a culture of Vietnamese orientation or American? What did you decide to do?
So actually, it's interesting because my dad is Buddhist and my mom is Christian, and then my husband is Jewish. So I mean,
You've got world religions right there.
yeah.
Good
So
for you.
I mean, my dad doesn't. I mean, my dad believes, when you practice, it's what you believe, and it's not necessary that you have to go to a temple or a church to practice your belief. And I mean, I introduced my kids to, both being a Buddhist and Christian, and you, but I don't really focus on that as much as just raising them to have good morals and treat people well, and so, and I mean, I don't think I focus too much, other than being a people, good person.
Are you insistent on good time management for your
Yes.
children, that they have to be
Well,
busy and do the home? How does that
yeah.
work? Explain it for.
So, so my all three of my kids play competitive tennis. So we tend to travel a lot. I mean, it's not. I introduce them to tennis, but it's their choice to play tennis competitively. So I think it's not just about tennis, it's just managing their time. They learn how to manage their time. I mean, I have expectation for them. I don't say you need to get an A in every single classes, but they know that you have to do well and you can't just, do things and not do it like, I mean, I'm a perfectionist, so I can't make them be a perfectionist too, but I need them to put all their effort when they're doing anything. to give it 100%, not just 50% or 20%.
I read Amy Chow's book a while back, where she explains her way of raising children more oriental, and she never allowed sleepovers and things like that. And how strict were you about the things like social life?
Um, so since they're so busy with tennis, because we're usually gone on the weekends, they tend to most of their friends that they uh, are through the tennis community. So their best friend can be in Indiana or in Chicago. So I don't think they miss it as much. My older two boys, they don't miss it as much with the, sometimes they wish like they miss out on the social, like going to homecomings or prom or doing other things with their friends. But I mean, when they're home, I do allow them to have the freedom to hang out with their friends more. I think with the sleepovers and stuff, I'm a little bit more easier on my two boys than my daughter because my dad the same way when he was raising me, he did not allow sleepover. He said, "I'll pick you up as late as you want to, but I'm gonna come get you," and you know because the sleepover. So then he always picked me up from. So I do the same thing with my daughter. I'm very selective on who I allowed her to have the sleepover. So because I I mean there's a lot of issues, but I don't want to like scared her. But as a parent, you need to look out for your kids a little bit more in this time. So
Do you volunteer at the schools at all? The children's
I
schools?
sometime, but I'm in my community. Like if I if I don't sign up right away, it's usually filled up. Like I don't.
Oh,
So my schedule allowed me to have like usually Mondays off. So and then I mean that's why I went into dentistry is to allow me to set my own schedule so then I can be have a career and yet take care of my family too. So I try to volunteer at school whenever I can, but I mean our practice also do a lot of charity um, events too for for the community.
are you concerned about bullying and drugs and um, general higher level of aggression that seems to be in schools these days, K-12
Yeah,
schools?
I am, but I think it's really important of who my kids surround themselves with friends. So that's really important too, and that's what I always tell them that your friends are really important. It's determined if you're going to be successful or not because friends, the one that are good will allow you to be successful. The one that's bad gonna make you do bad things. So I'm very picky in
Yes.
who they hang out. So that's why with tennis, you know, usually they are surrounded with great kids who are focused, has goals, and determined to be successful in what in tennis and in life too. So I mean, I find that with that, I don't have to really deal with that. But I do see the bullying through social media because my middle child had gone through it, and I didn't know about it until like a little bit later because of that. But then it is really important, and the to know who you are, who the kids are hanging out with, or what they do.
Uh, Thank you very much, Dr. Portnoy, for your thoughtful comments on a wide range of subjects. I was really impressed. Passion for life, passion for what you do, be a perfectionist or really care about things. I like what your father did. You can see your friends, but you can't have a sleepover at their house, and I'll come get you. I like the fact that you want them to be, well, in this case, in tennis, but in any case, to stay busy in the professional side. I love that you have technology at your fingertips and keep going, and that you want so much for people to do better in keeping their teeth. A big difference in your life and an infection. So I thank you very much for coming. I always close every program with basically the same request, which is please go out and do something kind for someone you know and someone you do not know, and do it again every day, and tune in next week. Okay. Thank you again, Dr. Portnoy. It was really a pleasure.
Thank you for having me.
To contact Junia, send her an email at juniadonsthespark@gmail.com. For more information, program schedules, and news about future guests, go to www.juniadonthespark.com. Thank you for joining us. See you next time on Junia Doan's The Spark.
Local productions seen on Delta College Public Media are made possible with support from viewers like you. Thank you.